That being said, I will turn things over to Eric Dennison to get us started.
Thank you, Casey, and the team at ASD for allowing me time today to talk to you about workers' compensation. As Casey mentioned, we have 30 minutes, so I'm just going to get started here right away. My name is Eric Dennison. I'm an insurance and workforce risk management consultant. I've been in the insurance and finance industry for coming up on 20 years. I went to my first ASD conference in 2019 in Baltimore, and I met a lot of new faces there. And I just wanted to say that I speak highly, and it was a very memorable event, and just I'll never forget. So my goal here today is to bring ideas to modernize offerings related to workers' compensation. Just real quick, I have to read a disclosure, or just go through a kind of a standard disclosure. This is meant to be for educational purposes. So if any of this information was taken in, it would be advisable to seek legal advice before implementing. All right. So just to give you a little outline, I'm going to talk a little bit about the first part, some trends, and then kind of go into some tech in the middle of this segment, and then finish with more of a FMS segment specifics around that. So here I'm just outlining some of the sources that I used within this presentation. And the first is Concentra. If you're not familiar, Concentra is a leading telemed provider for workers' compensation. You can go to their website, see more information there. But I did pull from some of their more recent information. Workers' Compensation Research Institute, the WCRInet.org, and American Academy of Actuaries, and the Business Insurance. So let me pause for a moment here. When it comes to workers' compensation and the role that FMS plays, I believe that the FMS is trying to do more than just help someone check a box in this category. It is my understanding that the FMS is really trying to package something of value for the participant employer. And I'll say that again. I really believe that they are looking to package something of value here for the participant employer. And I'll get more. I'll come back to this at a later point. First, some of the trends here. Typically, a big topic, I should say, the big topic here is mental health. I think we're all aware of this, but I just want to touch on the mental health as it relates to workers' compensation. So you have to have predominant cause, and if not aware, predominant cause really has to do with digging into the applicant's past. This could be something like finding out an abuse situation, or maybe a witness to a death, or even a divorce. Anything that can cause psychological instability could be considered here. Moving on, long haul COVID is still kind of a topic today that we're getting more information on, but it's still uncertain on some areas. And I would say that even when there's maybe an undocumented past COVID situation, and there's somebody that is looking to self-report, we're still in this sense of is there going to be limitations or a question mark on maybe caps in that type of situation? Even eligibility, I think there's still question marks in that. But there's right now currently 3 to 4 million people that are affected. And the most recent is showing that it's possible up to 30 million are affected. Now you got to think about this in terms of 30 million. We're just on the brink here of a recession, or just as we talk about the recession coming and we look at unemployment figures and that sort of thing, you would kind of think, well, this 30 million could have an impact here as well, to the unemployment numbers and labor participation. So it's kind of interesting, but and obviously broader categories of presumption diseases. This is kind of the stress of going back to work, anxiety, that sort of thing. And then states differ on presumption laws, and has to do with um, allowing mental health injuries in certain circumstances where either there's a physical injury. Some states require it be for first responders, and some states, for emergency medical personnel. So next, just a little bit about inflation here. Typically, you see healthcare inflation outpaces general inflation. That's the more common trend. What you've seen in the last couple of years is the reverse of that trend. You've seen actually the medical inflation is not the main driver of the general inflation. And some of the key drivers for medical inflation today are have to do with the labor shortage, and they also have to do with enhanced negotiations from the health systems, and further the technology in the imaging equipment adding to additional treatments. The details that are within some of those MRIs are getting picked up, obviously, and picking up additional treatments. Worker injury severity. This obviously, as we see more people exit the workforce at a later stage, maybe at that point seeing more severe type claims as well. So just a little statistic from the Bureau of Labor and Statistics. By 2030, workers 55 and older are projected to account for 26% of all claims. Moving on to more of the tech portion of this presentation. Um, so specific, I would say, again, I don't want to make this a plug for Concentra. I prefer to be vendor agnostic in any of this, but it just so happens that they are one that has a lot of information on the telemed side for workers' compensation. They are in 44 states currently, and so we can kind of get more information up to date on states and so forth through it as well. But if you're not familiar, I mean, just a little bit about telemedicine. I mean, we're talking about caregivers, typically some of the push and pull type injuries. Telemedicine could be a great opportunity to hit some of those injuries, like the strains and sprains, more of those repetitive type injuries and burns, maybe the first degree type burns, scrapes, rashes, things like that. And typically we see savings through reduce lost work time is a huge benefit, and also improving work case injury management here. And I would say that a big bullet point here is they focus on occupational medicine, and they are not contract clinicians. I think some of the other things that they have up to date here is their between open and closed claim, their duration is between 7 and 9 days, typically over 2 appointments. It obviously increases if you have a blood-borne pathogen type case, but needless to say, you can see they're approaching this early adopter stage and just getting out of that innovator stage in the adoption graph. I guess one other interesting to note is that they are piloting a mental health program at this point as well. as we talked about, they're in 44 states currently, and these two states here, just I think it just gives us to see where they end up here in the future. I think we continue to watch where they go. But Washington had reversed its stance. They had opened it up during COVID, and then just recently pulled back telemedicine. And with New York, they had recently passed legislation to make it where you have to be in person within a reasonable amount of time. And so, again, just kind of watching where these two states end up might be something important down the road here. I want to switch gears here for a minute, and I'm just kind of heading into more of a FMS specifics here, but I just want you to consider reporting lag time as a cost. And maybe you haven't heard this in the past, but typically, so claims when they're treated and left unreported for a week often increase costs by 200%. Let me say that again. Claims treated and left unreported for a week often increase costs by 200%. So I want to connect this with this next slide. And I want to see if I can get some feedback from you, see if this is something that we can explore further here. But as you look at connecting this last one on reducing lag time, reporting lag time, I'm wondering if connecting it to EVV and use that as a mechanism to basically report safe work history. So when an injury occurs, more information is available to the injured worker, and potentially offering them, an option like a telemed service to treat them, or at least being able to document the situation. So with that, I just, it could be an inflection point, it could be an opportunity. And I wanted to see if maybe just using your text box, kind of a yes or no question. And if you were to say no, maybe a reason, but do you see this as an opportunity within EVV to capture safe visits and worker injuries? I'll just let you answer. And I'm not sure if I have a Casey, I'm not sure if I see where the yes or no responses are, but
Yeah, I'm
maybe you,
not seeing any come in yet.
okay. And then I'll just, I guess, the last question regarding this would be just seeing if any groups that had over 5 work comp claims last year, if this would be beneficial. Again, a yes or no question. We're looking at, again, having a pivot point using EVV, capturing worker injuries, getting information over to the injured worker for the goal of reducing lag time, reporting lag time.
Eric, we did get one response, so I copied
Okay.
that over into the room in the upper left-hand corner. And if folks had any other comments or questions, you can be submitting those in the Q&A pod in the lower left-hand corner of your screen.
Okay. Well, the one just said yes. I mean, obviously having more would be a better group answer, but I just wanted to say, yeah. I mean, I think it's possible to use. I know EVV is a subject And I think that there's plenty there to potentially work together on something like this. All right, and I'm going to move on to again more like FMS specifics here. I want to share with you. So back in 2017, 2018, ASD had put together a work group for workers' compensation, and I know a number of members had wanted to participate and shared, some common goals. I think looking at different structures, whether it be individual, a group, administration type things, using economies of scale. I know Molly Murphy was involved setting this all up as well. And I just wanted to kind of revisit that time frame because it was before COVID, and we had got to pretty much up until lockdown, I'd say March of 2020, where members had shared enough data here to at least report back to the group what the findings were and continue with that discussion. Just so happened, obviously, with COVID and working on the COVID response, we knew that we had to put things on hold, and truly have not spoke and worked on this since then. And so with that, I want to just continue to the next slide and talk briefly about from that data set that we collected. We just there was around 12 members, separate FMS groups that shared data, and so we just really pulled five different groups, just a random sample at the time. 8 states that they were in, roughly 300 million in payroll. Work comp premium as an aggregate was right around 6 million, and the loss ratio was favorable at the time. And what I mean by favorable was anything below 15%. But obviously, there's some groups that have 0 or no claims for the entire policy year. So that's taken that into account as well. Group policies, these were all group policies set up in an estimated over 13,000 participant employers just in this little sample here above. I'm going to go back to that very beginning part of where I talked about, I believe that the FMS is trying to put something here, package something of value to the participant employers. And I really believe that part. And I think in that vein, I'm wondering if this could be something we could revisit again and see if what the next data set over this last 3 years might look like. Perhaps just relooking at what best practices and what value could be decided on as a group. And so maybe things have changed since 2020, maybe not. I know that I'd be happy to help, and I would like to see if you guys, if anybody outside of that original group wanted to be involved, we would, we could send out a survey to see interest level and see where, where that could go as well.
Eric, we did get one question.
Sure.
Does having a group policy put the FMS provider at risk as an employer?
Yes, there's risks with both policies, individual and group. And I think to some degree we went through some of that in 2019 or right around then. We did a full thing on group policies and risks related to that. And we can revisit that if need be as well. But there's definitely risk with group policies, and definitely when you cross state lines, there's definitely a level of risk.
Another question that we got, Eric, Would the value added options that were shared be part of the workers' comp policy or something that the FMS would need to advocate for typically?
In terms of the value, when I was referring to packaging something of value, what I was referring to was just more or less um, making sure that these participant employers even know that there is coverage available for them in case of an injury. So that's why I mentioned using tech potentially as an option there, with telemed option, or connecting with EVV in terms of pivoting and having them getting information. I think that's a big piece there of value that participant employers are looking for. And I don't know in terms of packaging, if we're talking about right now group policies, how they're structured, and what um, potentially adding like any other benefits or any other tech to alongside a group offering, what that would look like, because every carrier could be different in terms of how they're taking initial uh, potentially the first report of injury and that sort of thing. I hope that answers your question.
We also received more feedback to your earlier question, Eric, about connecting workers' comp to EVV. And this person said a strong no to connecting workers' comp via EVV. Very concerned about medical healthcare invasion of privacy for the direct service workers and caregivers.
Okay. So one thing with that, I do know that there was a group, I should say, there were more skilled workers, but a group that had worked with alongside maybe a billing solution, and implemented a safe visit verification. I don't think there's data or anything on that to the public about the benefits and so forth, or I should say where they are at with that. But I do know that this has been tested at one point. And I do agree that there is some concern there as well, that we have to be careful. Truly, it's open for discussion. I don't think there's a yes or no to it, and more just feedback and seeing if that's something to explore further, more or less.
Eric, as we pause to see if folks have other questions or comments, what's the best way for people to get in touch with you if they have any follow-up questions after the session?
Yeah, email is best. And I think, Casey, you have my email address. I mean, you can post it there, either in the chat or, even afterwards, if we were to look at, again, survey, or, potentially relooking at a work group, we can potentially, you can reach out to Casey, and we can get a survey out to you, and maybe add to the work group as well. And then I just want to say, as we kind of come to close here too, I know the masters are tomorrow, starting tomorrow, and I talked a little bit about mental health, and I don't want to make this a plug again, but it does kind of hit me in terms of mental health, and I do think there's a lot that still needs to be done in that area. So my belief is that golf is a social game. To me, I am not the best golfer, but I do find it to be a positive impact on my life. to play the sport and to connect with people that I might not even know, but meet out on the course. So I invite you, I guess, to look at this group, and I'm sure maybe you've heard of this National Alliance for Accessible Golf, and truly you can find more accessgolf.org. And I could share the mission here from their website, but it says our mission is for inclusion and is working to ensure the opportunity for all individuals with disabilities to play golf. So again, I just encourage you to look at it. I believe in it. Perhaps we could support that mission in some way, but more or less, use my name as a resource, my contact information. If you have further questions, you can obviously reach out to Casey as well, and she can get my contact information for you.
Great. And Eric, we had a question just confirming the name of the group. It was the National Alliance for Accessible Golf. Is that correct?
Yep. National Alliance for Accessible Golf. And I think, again, it's accessgolf.org.
Great. Well, thank you for sharing that with us.
No problem.
Okay, so I'm not seeing any other questions coming in. Thank you very much, Eric. And as a reminder to folks on the call, we will be posting Eric's slides and a copy of the recording on our website. If you have any other questions, feel free to reach out to me, Casey@appliedselfdirection.com, or directly to Eric, and his email address is in the chat.
Thank you so much, Casey. Thank
Bye,
you all.
Eric. Thanks.
Bye-bye now.